what we would like to do today really is to, share what we have been able to come up with, because I think in the first place, we have a moral obligation. A lot of you dedicated your time, your energy, and your ideas to contributing to the bulk of data and evidence that we gathered, out of which we've teased out these principles. So we need to return them back to you and sense check whether we are on the right path or whether we're totally off. And then at the same time, to listen to you to see how we can refine these better, so that with these principles we can then move into the more actionable phase. Because if we don't get this right, then the actions that will follow will also be off as well. So with this, I'll just pass the microphone, if it is a microphone, to Zaida Oth. Zaida is a postdoctoral researcher who is based at the University of Cape Town in South Africa. She was part of the team that worked as the internal secretariat during the convivial workshop in South Africa, collecting the various opinions and the various, suggestions that people were making on the propositions that we took to South Africa. Um, we worked very hard. I mean, she to try and bring in the various opinions and suggestions we were receiving. And so I'll ask Zaida now to just give us a rundown of these principles, these 9 principles. And then after that, we will start getting some feedback from some of the participants of the workshops. Over to you, Zaida.
Thank you so much, Caesar, and good morning and good afternoon, everybody. Just while we wait for the slides to come up, I will also give a bit of uh, introduction or a bit of adding on to what Caesar said in terms of the context. Um, so, I mean, as a South African, experience has showed me that solidarity is not optional. The solidarity, for example, that we've seen from other African countries during apartheid, from, the collective action of the treatment action campaign that resulted in access to life-saving HIV treatment for millions of people. We can see why these calls of solidarity in global health are prominent because we've seen what works when we all stand together and what is possible. However, the context where these achievements were made possible has changed significantly. I mean, since the start of this project, there's been drastic funding cuts to foreign aid. The latest UNAIDS report has shown that the reductions in treatment and prevention programs are already putting millions of lives at risk and also increasing vulnerabilities for key populations like women, sex workers, and adolescents. Also, in the last few weeks, we've seen that there have been increased xenophobic attacks in South Africa that have been fueled by anti-immigration movements. And this has also raised questions about who is funding these movements and the goals of it, because it is serving to undermine our goals for African unity and solidarity. But these are not isolated issues. And the reason why we've not really been able to get things right is because power doesn't give up easily, and fighting the status quo comes with resistance. So, for example, there's been evidence now from the European Parliament Forum for Sexual and Reproductive Rights that has shown that there are various national and transnational powerful organizations that are well-resourced, well-connected, and they've been actively funding these anti-rights and anti-gender campaigns since 2009. So these efforts have led to increased fragmentation within and between movements. It's also undermined the efforts, like Caesar said, of multilateral organizations. And it's also been reducing or shrinking the space for civil society, which is crucial considering the important role that they do play in protecting rights and advancing health equity. So considering these important movements in funding that is happening at the global level, and then also the important role that funding plays in the global health ecosystem, like Caesar said, it drives the health implementation programs, it drives who is prioritized, who gets counted, who gets involved in decision-making processes. And so for all of these reasons, it was the focus that the scope of the principle should then focus on the ecosystem, the funding ecosystem. And one of the goals, and it came up in a few of the workshops, was like, can we demand solidarity in this space? And while we recognize that many of these organizations are not solidaristic, they were not designed that way, they were not intended to be that way, We can't necessarily demand them to change, but what we can say is that within this global health space where we've called for solidarity, where we've committed to solidarity, we can adhere to the rules of engagement and work together in solidaristic ways. So these principles with the Finding Health ecosystem, as Cesar said, it focuses on different actors across the space, from researchers, implementers, government, civil society, and it also allows us to look at the different levels where solidarity is enacted, from the micro, which is community or local level, to the national, and then the broader global and international levels. Now, importantly, these these solidarity principles are not meant to be used as another checklist exercise. Rather, it should be seen more as an evolving standards of practice that require constant negotiation. So in using these principles, you can see in the box there's 4 different ways that we've imagined it. One is for structured prompts or reflections that we can think about. So if you are in a organization, it is a way for you to think about, are we engaging really in solidarity, or are these practices reflecting something more like charity or something that's a bit more extractive? And if so, how can we pivot and change it? And then also, solidarity is not something that emerges, in the spur of the moment, even though the calls for it are reflected in times of crisis. But it is built through sustained activities. So one of the ways is also that this could be a catalyst for increasing in those sustained dialogues of what solidarity is and how we practice it in global health. And then it can also be a normative reference points for structuring these funding arrangements and for thinking a bit more intentionally about research partnerships. And then, as Cesar said, we also want to use this as a foundation then for developing more tools that we can see how can we make solidarity actionable and improve the practice and understanding of it in global health. So for the next slide, please. We have these 9 principles that we developed into a 3-3-3 framework representing the triad of what solidarity is, how solidarity is done in global health, and then to what end. So in terms of the what, it was very clear across the workshops and also in the literature that solidarity is not just in rhetoric. It is about action and it's about doing. And it's the kind of action where you stand with and for others in ways that are not necessarily financial, but it could be emotional, it could be material support. It's not about what you have, but it is about showing up, as we've seen with communities in times of COVID. And it is through this doing and the showing up that we are able to build relationships with others and to identify with them in ways across difference. As we've seen, for example, with the solidarity campaigns for Palestinians in the genocide in Gaza, all of these different people from across the world have come together identifying with the cause, even if they can't identify personally with the Palestinians. And again, through this doing, we end up building specific type of relationships that also allow us to act and do in different ways. These relationships are grounded in caring, but they are also generative. So either building on your existing relationships and linking it to different networks, we move and we do in different ways, and it increases our capabilities and our response. And in terms of the how, it is mostly practiced through mutuality in terms of the how, and this is very different from reciprocity. So it's not like I am giving to you and now I'm expecting you to give the exact same back to me, or that is like the rule of it. Rather, it's recognizing that we are doing for each other and we're standing with each other for the common good, for a greater goal and a greater purpose. And what benefits you at the end of the day will also benefit me. And for this to happen, we do need a sense of trust. So again, going back to the what of the solidarity, that relationship, and the fact that it is not built in a once-off event, it's something that's built over time. So this trust is important for us to be able to work together and to know that you will show up to do your part, and I can have that trust in you to be there when I need it, and I will be there for you when you need it. And for this to also work, we need the respectful and inclusive engagement. So again, if we are coming together across our differences, it doesn't mean we need to erase it or ignore it or make it invisible. Rather, we recognize the strength of it, we work through it. It is about opening up the spaces for disagreements rather than hiding it or pretending that everything is okay and then, having it come out later. Um, so through this, we can actually work together and contribute in ways that can further the cause collectively. And for what end is also quite important because the actions and the how of it doesn't really matter if it's not aligned with the end goals. And for solidarity in global health, it is about challenging these different power differentials and challenging the structures that keep people in a state of oppression, keep people in a state of inequality, and recognizing that it's beyond the health drivers. So, how do we create structures or change structures that not only allow people to be healthy, but allow them to flourish, allow them to have dignity, allow them to live lives the way they can with agency? Um, and that is what our ends aspire towards. It's not just superficial goals, but it is something meaningful and something that we can all collectively stand behind for the people and for the planet. Yeah, and I think with that, I will hand over to Caesar, and we will also then look forward to hearing from our participants and their interventions. Thank you very much.
Great. Thank you very much, Saida, for summarizing these principles that we have come up with. And so we'll move on to the second part of the webinar now, where we have invited some of our participants in the workshops that we had across different parts of the world to just give us some feedback in order to stimulate the conversation that will come later on, whether these principles resonate and how whether they also, reflect the conversations that we had during the workshops. We have four speakers who will have about 4 minutes each to be able to feedback on these principles. And the first speaker I'd like to invite, I'll introduce each and every one of them as they come up. The first one is Dr. Peter West Oram, who's an associate professor of bioethics at Brighton and Sussex Medical School, the University of Sussex. He's a political philosopher and a bioethicist, and his research focuses on medical and public health ethics, global health justice, and the role of solidarity in addressing health inequalities and shaping ethical policy and practices. And the good news is that Pete has just published a book actually titled Justice, Solidarity, and Global Health, From Globalization to Collaboration. And I'm sure he'll tell us a bit more about that book. And of course, you're also invited to, look for the book. If I can do a bit of promotion for your book, Pete, yeah, I'll invite people to try and read the book. And Pete was part of the workshop we organized at St. Hilda's in Oxford, which Professor Sridhar Venkatapuram actually put together of people working in global health justice and international relations, where we discuss some of these ideas. So, Pete, over to you.
Thank you so much, Caesar. It's wonderful to be with everyone today. I was very flattered to be invited to come and to speak as part of this workshop. As Caesar said, I work on solidarity and global health justice and relating to what we can all be expected to do for global health and healthcare, quite broadly understood. I started working on solidarity in about 2014 when I was working with Professor Elena Books. And her definition of solidarity with Barbara Prainsack continues to influence my thinking on the subject quite closely. Reading the principles, it was quite a wonderful experience in a way, because it's rare that you get to read something that explains what you think better than you think yourself, if that makes sense. It was wonderful to go, oh, I get what I think about this subject now much more clearly. So that was a really nice experience. One of the areas that I'm particularly interested in is the way that solidarity does and does not function to facilitate the fulfillment of our duties to other people. And fundamental to that work is the principle or the idea that solidarity is absolutely essential and foundational to justice generally and to successful global health practice. So there's a moral component and a practical component to my thinking about solidarity. As has been mentioned, I was one of the participants at the St Hilda's workshop in Oxford in 2024. And we had quite a very productive conversation across disciplinary lines between international studies scholars and philosophy, and others. And many of the participants hosted and attended a roundtable at the British International Studies Association conference in 2025. At these meetings, we discussed quite a wide range of issues relating to solidarities, both as a concept and a practice, and the need for practical and which is actual meaningful engagement with the process and practices that drive global health. So, and I think these ideas are reflected in the draft principles, and particularly in principles 1 and 2, and the emphasis on solidarity being grounded in action rather than hope or good wishes or feeling or emotional responses. I think that for me, an absolutely fundamental part of solidarity is that it is enacted, that it is something that we do for the benefit of other people, ideally, but sometimes not necessarily so. And I think that the principles provide both a really clear articulation of what the concept is, but what it can and should do, and how we should go about engaging in it. I'm particularly struck by the induction in the preamble to the principles. And apologies for quoting it back, but no single principle defines solidarity on its own, but they are distinct features when assembled together reveal a picture of what solidarity looks like. And I think that for something as complex and contested as solidarity, the framing of this isn't entirely definitive, but it shows us what we're looking at. It helps to define the terrain while providing a definition which I think is pretty close to definitive. One thing, and I'll wrap up, is one of the things that I'm interested in is how solidarity sometimes fails, or how solidarity sometimes functions in ways that we may not necessarily endorse. And I absolutely agree with principles 8 and 9, but I think it's worth considering the extent to which solidarity may be deployed in a fashion which is narrower than may be necessary or good for meaningful progress in global health. It's been mentioned that during the COVID pandemic, various nations were hoarding and stockpiling vaccines to the extent that they couldn't possibly give them to their populace, while other nations were denied access to even a minimum standard. This is exclusionary, it was harmful, it was counter to effective global health, sorry. But it did reflect the kind of narrow solidarity or nationalist solidarity that was mentioned already. And I think that it's important to acknowledge that while these kinds of actions are not to be praised or are actively harmful, they do in some ways reflect a type of solidarity which is exclusionary, which is potentially hostile to people outside of a narrow group. And as has been noted, this kind of national solidarity may undermine global solidarity. I'll finish up there because I realise I've gone over my 4 minutes, but I think the principles are fantastic. I'm really curious as to how they can be used effectively to change actual delivery of global health. Thank you again.
Great. Thank you very much, Dr. Peter West-Oram-Beat. That was very helpful. And yes, you are right. We've also been struggling about what to do when solidarity is invoked and used in ways that exclude others and potentially harms other people. That is an aspect that I think we will need to take into consideration seriously as we're designing the actionable tools. And so our next speaker is Dr. Suzal Tim. She's a lecturer in development studies in the Department of Anthropology and Development Studies at the University of Johannesburg. Her research interests include environmental governance, regulation, urban informal economies, municipal waste management, and relations between humans and non-human actors. She holds an MPhil in criminal justice and a PhD in criminology from the University of Cape Town. Dr. Tim has worked closely with the Rural Women's Assembly and was part of the research team that produced the photo documentary exhibition, Guardians of the Seed, Land and Life. the seed research journey of Southern African Rural Women's Assembly. She's also a member of the Rita Edwards Collective and has co-authored work examining the invisible labor of community health workers and their contribution to building a healthy society. She participated in the Solidarity, Embodied and Enacted Learning from the Rural Women's Assembly Southern African workshop held from the 23rd to the 25th of February 2025 in Cape Town. This was a workshop that was organized by our team, led by Donna Andrews, I think who's on the call, and Argentina de Vries. And from what I saw, because I joined online, this workshop was full of a lot of energy. And I felt, they gave us quite a great deal of input. So I'll hand over to Dr. Tim now, please. Over to you.
Good afternoon, everybody. I'm just sorry that for some reason my camera decided to stop working. And it would have been nice if you would at least seen my face. But thank you very much for the invitation. I really appreciate it. Thank you very much for sharing the principles, but most importantly, thank you very much for being part of this process of the workshops, and also for being able to be in the same room as the Rural Women's Assembly, colleagues from or at least our friends from the Farm Worker Union, as well as our friends from the Palestine Solidarity Group. So that was quite a privilege in a sense also in that way. So for me today, I will be speaking to the principles, and I think the principles in itself captures a lot of what has been discussed in the workshop. However, I would like to kind of like come to the principles in a different kind of way, instead of just like, for example, saying what the principles, whether it's accurate or whatever the case may be. So just a bit of background for myself. I think a lot of my solidarity work comes from my experience of being part of women's organizations such as the Rural Women's Assembly and the Rita Edwards Collective. And for me, solidarity has been something which I have been kind of like practicing in a way, and the various ways of embodying solidarity. So I come to this conversation from that perspective, in a sense. So instead of me asking, or at least like I was saying earlier on, the question around, does the principles align with what we've done in the workshop? Yes, it does align in a sense, but I want to know what do these principles actually offer for RUA and also for women's organizations more broadly. I cannot necessarily say for RUA specifically, but thinking more broadly about women's organizations in a sense, in that way. So one of the key focuses of the workshop was about looking at solidarity as something which is embodied. And I think a critical part of that was, or at least a critical dimension of this workshop, and what I think the workshop has done very well, is around bringing the aspect of reflexivity into thinking about solidarity. So a critical reflexive approach when we begin to think about the principles is more like asking, what type of work is the principle supposed to do, or what type of work is the principles intend to do in that way. So based on this, I actually have a lot more questions than I have actual, at least straightforward answers, because I think in many ways I myself are also grappling with these aspects as well. So the question which I start from is basically what happens when we turn the lens back onto the principles itself. And so here I was looking at the principles and I asked several questions, which is around the kind of structure of the principles, which looks at the key questions of what, how, and to what end. And these questions are very critical because it does assist in terms of making visible the work that is involved when it comes to solidarity and solidaristic practices. However, I'm left with asking, does this make does making visible what solidarity could look like, what does it have to offer for us? So my question around this was around, what are the implications of a normative framework when it comes to the solidarity principles? And normative frameworks, I'm not against it or anything like that. I think normative frameworks have something which is very important to offer for how we think of something. However, I think it's quite critical for us to also reflect on what these kind of normative frameworks also involve, but also most importantly, what are some of the underlying assumptions of the normative frameworks that kind of like informs how we think about, in this case, the principles. So I was left asking, when I look at the principles, what does these principles actually enable? What do they make visible? What does it obscure? And what effects do we think this could possibly or potentially produce? And also, what are the silences and the tensions when it comes to the different principles? So, in a sense, I think the Rua workshop offered something which is quite critical when it comes to thinking more carefully about this. And for me, what stood out in the workshop was specifically the methodological approach that when we were discussing how we enact solidarity and how solidarity is embodied, it was from a kind of grounded approach, like opening up the various avenues in terms of how women are experiencing, or at least ourselves, how we are practicing how we're practicing solidarity. So my question in that sense, when I think of the solidarity principles and the kind of normative underlying way of thinking about it, not that there's anything wrong with it, I begin to ask myself, what would it be useful to take the principles and shift it towards a more kind of like descriptive framework? Because if I think about the workshop, out of the workshop, there were several aspects which comes out, but also rich stories, case studies, and there was so much texture to that. And I think, of course, it's difficult to capture all of these things in the context of the principles. If you were to bring together a normative and descriptive framework, and we kind of like bring into the center a methodological pillar to speak to all the different principles. And there is some kind of methodological underlying kind of like reference to some of the things, especially when it comes to how solidarity could be enacted. But I think in some way, a more explicit idea around methodology in relation to that, but also methodology not to be prescriptive in a way, but methodology to help to actually unearth the kind of critical aspects of solidarity in that sense. So I'm leaving you with this question by asking, what work do these principles actually do? And what becomes possible when they are brought into conversation with the lived and embodied experiences of solidarity? And this is something which I've been thinking about, but also I think what the workshop, specifically with the Rural Women's Assembly, has made visible to me and has brought to the fore. And yeah, thank you very much. Thanks.
Excellent. Thank you very much, Dr. Suzal Tim. So, yes, we have, collected your questions, and actually the idea of what these principles will do is precisely the next stage in the project, because they will do different things for different people. And so hopefully through the engagement with different people, we will be able to tease out, without necessarily coming up with a generalized what they will do for everyone. But I thank you very much for this, for these reflections, and also the idea of including a descriptive to the normative. Yes, you're absolutely right. This is just a teasing out of, normative ideals that we have put together. There is a whole descriptive narrative, I think even captured partly in the reports that we generate. But yes, maybe in the final product, we will also ensure that, there is a descriptive part as well that captures the embodied and lived experiences. So thank you very much. The next speaker is Dr. or Professor Francis Njoku. So we're moving from Cape Town to Nsukka, the University of Nigeria. Professor Francis Njoku is a professor of philosophy and jurisprudence at the University of Nigeria, Nsukka. His training spans philosophy, legal studies, ethics, social and political thought, with qualifications from institutions including Oxford, Duquesne, the Gregorian University in Rome. And his work explores African philosophy, law, ethics, justice, religion, and the philosophical foundations of social life. Professor Njoku Francis was the convener of the expert workshop on Igbo Conceptualisations of Solidarity held in February 2025 at Nsukka. And, he has done work on the topic of solidarity, and we're grateful that you've made the time, Francis. So over to you. Francis, can you hear me?
Yes, I can hear you, but can you hear me?
Yes, we can hear you. We can't
Okay.
see you, though.
Yeah, I don't know. Thank you very much. Good morning, everyone.
Right.
Since I have gone through the principles, they're quite nice, and the way they are framed, the very triad framework. What I want to add is that before we begin to say what solidarity entails, one needs to know what solidarity is, where it is rooted. And from that point of view, I think we need some kind of a metaphysics of solidarity. Because if you know what it entails, then, and where it is rooted ontologically, and then within the cosmos in which solidarity is practiced and conceived, like, for example, the Igbo African background, you begin to know why people behave the way they behave, whether the way they behave is because of the way they understand their own nature within social interaction. So, it's a certain anthropology on that. So that's why when I went through them, I said, well, solidarity entails relating and identifying with others, as you said, but it roots in a certain metaphysics, facts about human nature, for example. The Igbo man or the Igbo person would think that everyone has a gift, has chi, and people have it independently, differently. But the bad news is that each one's own is insufficient. There's something I have which you don't have. There is something you have which I don't have. Already ontologically, there is a basis for relating in order to complement what we have. So I think that idea would be nice to come in trying to understand why solidarity and what it is. Another fact is also the way the person reads the world that can make room for solidarity. Given our own background, you see, what you might call the forest of existence, nothing stands alone. People, entities cuddle into each other's spaces. Given that understanding, there is a certain insufficiency, a certain vulnerability that is built into human nature. So, given that there's need again to practice solidarity, again, the cosmos itself is not very clear. It has all kinds of baggages. Other is mixed with disorder. So you have to make certain choices, the rest of them. So we are vulnerable by nature. So we can only complement, we can only, go along, practice the human project if we lean on one another, cuddle into each other's spaces. You see, when we talk about the Ibuanian and working together, that the load will be light in that sense. So if you understand ontologically, from point of view of anthropology, the human insufficiency and the world in which we live, then it becomes clear why solidarity is part of our nature demands it in order to get along. So that's what I will add under what. So how then do we do that? So solidarity, the way you can practice that is commitment to the human cause in its various levels, carried alongside with empathy, involve, involve, involvement in the human cause and welfare variously that can be sustained. Then to what end? Why do we lean on one another? Why do we cut into each other's spaces? Why do we use others or in their interactions to complement our own insufficiency? The reason is to survive. So it's to survive. So when we are practicing solidarity, it's not a question of begging or asking this one. It is something that without it, none of us will survive. So I think if we look at solidarity on that metaphysical basis as part of our nature, possible or part of something that we must attend to, because the human nature needs the complementation of others, and no one can traverse the course of human project alone. So then we can appreciate solidarity. Why it is a human commitment. It is part of our metaphysical commitment. It is part of our anthropological commitment. It's part of our social interaction, that without which it is difficult to survive in this terrain. That's what I would like to add. Thank you.
Thanks very much, Francis. That's very good. And I think this is beginning to give an idea to all of us. I mean, you see how this project was complex in bringing together here. If we, I mean, whereas, Dr. Tim was insisting a lot on the embodied experiences, here Francis is pushing us more to the ontological considerations, drawing from the Igbo conceptualizations. And this is it. This is what we're trying to bring together in this project. To make sure that, and that's why we describe the project as a pluriversal project, because it allows for different conceptualizations, but can lead us all towards a concerted action. Now, our next speaker is Dr. Irene Honamse. Dr. Irene took part in the first workshop we held, which was at the University of Ghana in November 2023, if I'm not mistaken. I can't believe 3 years have gone by already. And Irene is a research fellow at the Research Center for Health Policy and Implementation Research at the University of Health and Allied Studies, Ho in Ghana. And she's a recent, recent, right? Postdoc. And she's doing a quite interesting work, intersection between bioethics and sort of like community engagement. And I'm happy to have you here so that you can share your reflections with us, Irene.
Thank you, Caesar, and thank you for inviting me to speak today. Looking back to 2023, November, I remember, to what started as ideas and debate, in that conference room, to seeing almost all the discussions and the topics reflecting in this framework, these 9 principles, is very much encouraging. I want to touch on, I think, 4 key principles, but I've lumped the first 3 together. What really resonates, looking at the principles and then looking back to the workshop of 2023, I look at how the principle, touch on the fact that solidarity is action, and also means identification, and then also a relationship. And I remember during the discussions in 2023, we were very clear that solidarity is not charity, and it's also not sympathy without sacrifice. And the fact that support should not end when crisis has passed, and that there should be that continuous relationship building. And Principle 1 really captures that, and I'm so happy with that. As somebody who is also very passionate about what do you call it, inclusive engagement, specifically inclusive community engagement with the marginalized and those in the rural communities. I'm also happy about the principle number 6 that touches on respectful and inclusive engagement. And also referring back to the meeting in 2023, I remember the fact that we made emphasis on valuing community knowledge and not just, bringing committee members around the table to accept what has already been agreed on by supposed experts. And then I also believe that genuine inclusion means that communities are included, in shaping decisions and not merely responding to them. And I'm also happy to see that in principles. Now, just reflecting also on, ways we can strengthen the principles or the framework. I also remember that one key theme that was critical during the meeting in 2023 was the spiritual and intergenerational understanding of solidarity, which is found in most African, traditions. The fact that we are connected, not just to ourselves as living beings present, but also to those who were before us, our ancestors, and even those yet to be born. And you agree with me that in most African communities, solidarity is embedded in us as human beings, and it's something that we cannot do without. So although I know that the principles are action-oriented, I don't know if it's possible to acknowledge this deeper dimension of the, what do you call it, intergenerational part in the preamble, just to acknowledge that. And I also want to flag the potential tensions between institutionalizing solidarity and preserving it as a relationship. You remember in Accra, we discussed the example of Ujuma or Ujama in Tanzania, and the fact that when solidarity becomes codified, it risks becoming compliance. And I'm also glad that the framework states that the principle is not a compliance checklist, but I'll encourage that as we try to test the tools, as the tools are rolled out, we keep an eye on emphasizing that. So I would like to conclude by saying, and I want to touch on what Zaida said, that for us as Africans, solidarity is not optional, it's part of us. So I want to conclude by saying that I look forward to continue conversation. I'm happy to be part of this work. Thank you very much. I'll end here. Over.
Great. Thank you very much, Irene. I think the points you raise are very important. The point about intergenerational solidarity is something that we have heard in different workshops. And especially if I think about the workshop we had in, or the research work that one of our researchers, Ashish Kiri, did in the Himalayan region, we also came across the whole idea of, solidarity beyond humans, also solidarity with the non-human, with the environment, with nature, and with some particular beings. And I think this is something that is difficult to capture. We haven't captured it in the principles, but like you say, I think we should add that to the preamble. So thank you very much for that. Now, we'll have the final intervention before we then open up for the contributions from everyone. And I'd like to invite Professor Bonaventure Nwokioma, I think I pronounced that right, who's a sociologist and a criminologist. Today we have two criminologists, right? From the Department of Anthropology of the University of Nigeria, Nsukka. And he His teaching spans criminology, criminal justice, security studies, community participation, rural development, human trafficking, and the social dimensions of poverty and inequality. He has examined community participation in development, tackled issues on cyber awareness, kidnapping, prison conditions, and other, extreme sort of humanitarian situations as well. And he was also very instrumental in the workshop we held at the University of Nigeria in Nsukka in February 2025. So over to you, Bonaventure. Happy to see you.
Thank you. Thank you very much, Caesar. I'm glad to be a part of this global discussion on solidarity. And I'm so regard this as a privilege to be part of this. And I want to commend the efforts of Caesar and the General Solidarity Group for taking the pains, to hope, and also for putting together the outcomes of those workshops in a very synthesized framework that is presented to us today for discussion. Most importantly, it gladdens the heart to know that the organizers thought it wise to bring back this synthesis of outcomes back again to the formulators, those who participated in making it possible. So I think this is something that is worth commended. Looking at the principles, the frameworks, I think they were divided into 3 triads: how, what, and to what end, as well as 9 principles. Looking back at the workshop we held at the University of Nigeria in Nsukka in February 2025, I would say that these principles tried as much as possible to capture, the things that we did, especially in relation to the Igbo conception of solidarity. I remember in that workshop, we identified in a very clear manner the traditional concept of the Igbos in relation to, some of their values, some of their notions, that brings them together, that rally the people together as one. And those concepts that were captured in the local terms or concepts like Igbebike, Umunnabuike, Onyagala Nwanneya, and so on and so forth, were aptly captured in the principles, especially. Indeed, it ran through the whole triads. It ran through the 9 principles, but specifically in the first triad, principle 2, solidarity is a form of identifying with. The Igbos usually will have this traditional identification with each other, which is embedded within the culture of the Igbos, as Professor Njoko had pointed out earlier. It ran through the networks of kinship, to the networks of community, and it doesn't have boundary at all. Even when people are in the diaspora, they do not lose touch of the home. They still connect and assist wherever necessary in ensuring that issues that arise from the home are effectively taken care of. And these principles resonate directly to health, but not just only to health. Even in other situations like conflict, like war, like community service, like round. And so I could say boldly that the solidarity as a concept is entrenched or woven around the Igbo culture, but not just the Igbo culture, also other African culture, as pointed out by the last speaker. Of course, it also goes beyond the immediate, beyond the present, and even relates or translates to the world beyond, and so on and so forth. But looking at these principles, I see a huge challenge in the practicability and actionability of the principles, which seem to be a contradiction to the avowed direction of the framework, which states that the principles of frameworks embedded in solidarity as a normative pillar of global health funding ecosystem, and so on and so forth. But directly to the point that these principles are actually represents solidarity or practices, that needs to be incorporated in the health funding ecosystem. I think the next effort should actually be channeled towards the practicability, especially within the context that we found ourselves today, as pointed out by Cesar in his intro. There are a whole lot of challenges around, nationalism, around around isolationism, around atomization of nations and people that seem to contradict the efforts of solidarity, not just in health related issues, but generally in other aspects of human governance globally. And I would want the next efforts to be channeled toward this, so that the contradiction around the solidarity practices aiming to reject and broke down the existing structural imbalances and inequalities, in juxtaposition to what we're having today, which seem to promote the opposite, which is building walls, doesn't solve any problem, and so on and so forth. So it's nice for the global health solidarity to fashion out a practicable way through which these principles can actually be actualized and realized. Thank you very much.
Great. Thank you very much, Professor Wokioma. This is helpful. You're absolutely right. The challenge now is the actionability of these principles. So at this stage, I would like to open up the conversation to all our participants. If people on the call would like to give their views and also contributions and feedback, we would be very grateful for that. You could do that just by raising your hand. I see that, one of our co-PIs is also online, Professor Élisée Nouvet, who carried out the interviews that led to the propositions and then the principles. And so, Élisée, if at any point you want to come in, please feel free. So there's a question from Jaeun Noor, I see here. She says, fascinating to see what came out of the workshops. I'm wondering whether any elements are specific to the field of global health. I would also like to hear more about Principle 7, challenging the power differentials. What type of power can be effectively challenged through solidarity? Um, yep. So, I mean, if any of our speakers want to weigh in on that, I mean, or Professor Elisée Louvet as well, if you want to come in, that's fine. And then maybe I could also say something. And then after that, we'll take the question from Mercia Andrews. Well, I mean, if you want, I'll go first to the question on the specificity. Yes, I mean, solidarity, and I think Professor Nwokioma's intervention actually highlighted this. Solidarity goes beyond the health space, but the global health space as part of the community. I mean, the space within which we interact is a space whereby we can actually focus these principles of solidarity, but the principles could actually be applied also in other contexts as well. But we've designed these with the global health space in mind. And about challenging power differentials, yes, I mean, if we look at the history of solidarity, and I think Zaida mentioned this, and I mean, she mentioned that in her introduction, talking about, I mean, the anti-apartheid movements in the southern part of Africa. Historically, there's also, I mean, apart from the dimensions of solidarity that bring people together to sort of like flourish better, there's also been, another narrative of solidarity, and the two go together, that is more towards challenging power. And that stems from the realization that sometimes as individuals, we may not be able to stand up against power, but together we can do more. And if it is specific types of power, we can look at, I mean, in the global health space, there are different types of power differentials: economic, epistemic, even cultural. And these would all have to be challenged if we stand in solidarity and we're working towards equity. So it's not that we are going to focus only on one particular type of power differentials, because there are many power differentials, and even power differentials within countries, and within the field of global health, even in local spaces. So yeah, Pete, do you want to add to that?
Thank you so much. I was just going to say something similar, I think, and the function of solidarity can often be expressed through democratic processes and democratic engagement. And I was going to mention sort of international solidarity in response to various injustices. And we've seen recently in the moves by South Africa to bring the Palestinian situation and the genocide being perpetrated there before the International Criminal Court as an instance of global solidarity or international solidarity, at least, and equally in even smaller scales where injustices are happening at a local level. The democratic engagement, I think, it can be a powerful move, not always, but can be highly effective in challenging those imbalances and inequalities. And I think that derives or grows out of the recognition of similarity or the identification with providing support to people at an interpersonal level can challenge that even at a micro level. And it can grow from there, I would suggest.
Thanks very much. Mercia Andrews, you had your hand up, or your hand is up.
So good afternoon, everyone.
Good afternoon.
My name is Mercia Andrews, and I'm from the Rural Women's Assembly. We were one of the participants I was also a participant in the South African workshop that Dr. Tim spoke about earlier. And there are several, I think, important aspects that I want to just highlight that perhaps didn't come through sufficiently in the earlier conversations. One of the case studies, or several of the case studies, actually spoke to the point that Peter has just spoken to, and it was about responding as solidarity to injustices. And one of the case studies that was presented at our workshop was a collective response to the situation of farm workers in the Western Cape, how they were treated, how they were earning. And this happened during a moment when farm workers undertook, for the first time in history of South Africa, undertook a revolt, I should say, a big rebellion. So there were several aspects to the case study. Not only was there a lot of solidarity in the region in relation to injustices, people could relate to it very directly. The second issue was that in the process of providing solidarity, being in solidarity with and enacting solidarity, one also began to see the transformation, the transformative process that was unfolding. It was clear that those who were in solidarity began to understand for the first time the real conditions that farm workers were experiencing. And so it became a real active moment of transformative action on behalf of those who were acting in response to the situation of farm workers. There were several other, I think, important dialogues that also emerged. And one of it was that solidarity was also often very practical. It wasn't, it was an act of being with. It was an act of going out to these communities, etc. At the moment in South Africa, this level of solidarity is also being enacted with the xenophobic outbursts that we see across the country. So I think the key issue that was a takeaway for me was the way in which often we were probed about the difference between solidarity and charity. And I think this notion of what is charity, what is solidarity, or is there a continuum? When does the one become the other? Or how do the two influence each other? I think that was also quite an important aspect. I think lastly to say, as the Rural Women's Assembly, this notion of solidarity has become, through this process with the University of Cape Town, it's become quite embedded in our organizational culture and our organizational thinking. So thank you.
Great. Thank you very much, Monsieur Andrews. And I think the point you have highlighted is important, and maybe we can bring that more to the fore in the principles, which will be, to consider the process of engaging in solidarity itself as a transformative process. So it's not only the outcome, but the process itself generates transformative energy. And I think that is a very important point. And then the distinction between charity and solidarity that has come up in various workshops. It came up in the workshop in Ghana, and I think it also came up in the workshop in Costa Rica as well. And, the idea is that whereas charity does not really require an identification with the other person, because you can actually do charity out of pity because this person is not like me. Solidarity implies identification with. And I think that is the important distinction that has emerged from this work that we're doing on these topics. So I think we're now getting to the end. I can see that Agneta has put her camera on so that we can see her. I just want to thank all our speakers and all of you for participating in this workshop. If you have any further feedback on these principles that you think there are ways we can enrich them, please let us know. I don't know whether there are any final comments that our presenters would like to make. Just a minute each, if you have any final comments, and then Professor Louvet as well, if you want to come in, just a minute each, and then we'll hand over to Agneta to conclude the session.
Good morning. Yeah, thank you everybody for participating. And I was present only for the Ghana workshop, but I have led the qualitative empirical work to map conceptualizations and experiences and embodied understandings of solidarity. And it's wonderful to hear the resonances and points of emphasis offered by the speakers today, which certainly in the more descriptive accounts that you'll be seeing issuing from the publications that accompany the principles based in empirical work, but as well, I encourage you to look at those reports from our different global workshops. Because you will definitely see your voices echoed there. And congratulations to the organizers of the feedback session. I'm very happy to see the engagement and enthusiasm for the principles, but as well, we need your feedback, and we've taken note, Caesar and Agnes and I. Yeah, so thank you for this really thoughtful engagement from Canada.
Right. Must be early for you. Right. So any other final comments from our speakers, and then we can hand over to... Okay. Well, so we'll hand over to Agneta then. Agneta, if you can wrap up on this session. And thanks everyone, really. This has been quite useful and very helpful.